So what do you know about diabetes? Sandy? Followed?
I'm sorry, I thought it was a general question for everyone.
There are only two of you. Followed usually not participating, so that is why there is only you left, Sandy.
Okay.
So what is diabetes?
Diabetes, it's like
What is a
lack
diabetes?
lack of insulin.
Okay, lack of insulin. So what are the types of the diabetes?
We have type 1 diabetes and type 2
What is the
diabetes.
difference?
I think type 2 is affected by genetics,
They
while type
both.
1. What?
They both are affected by
They are both affected by genetics.
yes. Type 2 is more affected, but still they are both genetically uh, inherited. So what is the reason for the type 2?
It's like insulin resistance.
Yes, it can be because of the resistance to the insulin, and also
Um, Insulin secretion is not enough.
yes, it's not enough. Why it is not
But
enough?
in type 1, it's complete lack of insulin.
Yes, right. So type 1 is there are no beta cells. Type 2 there is a lack of the beta cells because of the autoimmune uh, ulcer, and so the beta cells are destroyed by the immunity. So okay, then so which drugs are used for the treatment?
For type 2, insulin administration. Both of them is actually insulin administration.
No, no, it's usually only for type 1. So type 1 requires injectable insulin. So type 2 is usually oral agents.
Diet. Hmm.
Though some type 2 patients may require insulin injection at the end of their uh, treatment. So like after
When the
5,
insulin levels are completely low.
yes, when they almost is type 1. So like eventually all type 2 patients will switch to type 1. So just before the switching, they may require uh, additional insulin injection additional to the oral therapy. But fortunately, most of the type 2 patients uh, are well managed with the oral agents, so that is convenient and uh, less expensive also. So, what types of the insulin do you know?
Types of insulin.
Yes. Classification of the insulins.
You mean pro-insulin and then the active form of insulin?
The drugs.
Mm-hmm.
So the types of the insulin, like in biochemistry, like uh, the synthesis is like it's good if you know that, but it's if it's not produced in the patient, then uh, most of the time we have to inject it exec- uh, exec- exogenally. So that's why.
Mm-hmm.
Uh, so the most important type of the drugs are insulin itself. So and there are many types of the insulin. So what are they?
Like this one produced by yeast or from pigs.
Yes, there are different sources for the insulin, and
Mm-hmm.
the pig and bovine insulin can be used in humans. However, what is the difference of the bovine insulin?
Difference in what?
In the insulin, is it identical for the human or is different?
Do you mean
Bovine.
the preparations?
The bovine insulin, is it identical to human or different?
What insulin?
Bovine pigs. Sorry, from the beef.
Uh-huh. Is it different?
I am asking you if it's different or not.
I think it's different, but it
It's
was modified.
no, it's not modified. It's different, and it remains different. So the pig is less different. Like
Mm-hmm.
the pig has only one amino acid that is different, and bovine has two.
Mm-hmm.
So that is why pig insulin is like more identical to human, and both are effective in humans, so can be used instead of human. So what else types do you know?
From Escherichia coli.
Yes, so that one that obtained genetically um, with the modified Escherichia coli. So what are the types?
I don't understand what you mean. Like,
Types of
what
the
types of
insulin,
insulin?
like normal insulin, short acting, long acting, intermediate
Oh,
acting.
okay. We have rapid acting and short acting, intermediate acting and long acting.
What are they? Names, please.
For each one.
Of course.
Okay.
There
For
are
rapid
Sandy.
acting.
See,
Yes.
when you will work at pharmacy, the patient will not uh, uh, ask you, please give me a short acting insulin because there are plenty of them. They will ask you the name of the drug. So you have to learn to know that by heart.
Mhm.
So
Okay.
what are the names of these
Um,
drugs?
regular insulin, insulin lispro, insulin aspart,
So what is it?
insulin glulisine.
So what is the type? Is short acting or what?
This is both rapid acting and short acting. Regular insulin, um, is a short acting, while the rest are rapid acting.
The rest are what?
Rapid acting,
So
fast acting,
what are the rest?
like Lispro and Aspart and Glulisine.
Okay, so these three are rapid acting.
Mhm.
So rapid acting is shorter than the short acting, right?
So rapid acting is what?
Shorter, shorter duration uh, than
Yes,
regular.
yes.
Okay. Then
Then intermediate acting, it's NPH.
Sandy, please continue. Don't stop.
Hello,
It's
do you
I
hear
am
me?
listening you. That's no need to
Okay.
make a pauses with the half minute. Pauses are not very effective.
Okay, intermediate acting insulin, NPH, which is neutral proamine Hagedorn. It's an
What? Hedge
intermediate
what?
Hagedorn.
Hedge dough? What is hedge dough?
NPH, neutral protamine Hagedorn.
Uh, ha Hagidon. It's Hagidon.
Hagedorn? Okay, sorry. This one is, it's an intermediate acting insulin. And long acting insulins are
Lulizine and Detamir. Glargine,
what?
Glargine
Glargine, yes.
and Detamir.
And oh, yes, Determir.
I am very impatient today, so please answer quick.
Yes, I'm answering.
So Jakob, Ahmed, and Salma, please participate in the discussion. Hulud, you too, please. I would like to hear from you too. Okay, then. What is the mechanism of action
For which one?
for all of them?
They all have the same mechanism of action?
Yes, they are all have the same because they are all insulins. Salma,
Yes, teacher.
answer the question, please. When I
Okay, teacher.
when I tell your name, you should answer the question. You should not answer yes, teacher.
Okay, because there was someone is speaking, so I don't know.
When I tell your name, that means that it's time to speak for you.
Okay, teacher. Actually, all the mechanism it's like for the insulin preparations, they are for increasing because the body cannot produce insulin. So this is artificial or exogenous insulin. So um um
So it is replacement. So the mechanism is replacement. Good. Then, what is a
so
pharmacokinetics?
um wait, teacher. So just a minute, teacher. So it's it's polypeptides, right?
What?
It's polypeptide, right?
Yes, insulin is a polypeptide.
So it must be subcutaneously intake because if they are in gastrointestinal tract, they will be destroyed, not work sufficiently.
They will not work at all because
Uh-huh.
all proteins are destroyed by the peptidases in the GI, in the uh, uh, stomach, and also the acid will destroy the protein structure.
Mhm. Okay, and also there are dosing before meals, like as it depends on if it's long term or if it's the one which is we have three stages. We have the long term, right, teacher? And we have the intermediate, and we have the rapid acting. So they have to be injected before meals depending on the time of their action,
So what is the
right?
purpose of the short acting and long acting insulins?
Actually, I see the difference only is in the time of their action.
Okay, but why we need two types, short acting and long acting?
Actually, for short acting and long acting, I don't know, but what I know that short acting it works 15 minutes after injection, and the long act and the normal insulin it takes from 50 to 120 minutes.
I think it depends on the severity of the case.
No, no, it's not depend on severity. So when in healthy humans, the insulin is secreted continuously, right?
What?
So in healthy humans without
Yeah.
diabetes, so the insulin is secreted continuously during the day, right?
Yes.
And when you take a food, it increases, right?
Let me see. The microphone is on. Sorry, teacher, it's my roommate.
Okay. So so when you eat, the insulin release increases, uh, right?
Yes.
So that is why we need two types of insulin. So one insulin to replace the basal secretion, and second, so that it should be long acting for basal secretion. And second type, short acting for mimicking the after postprandial secretion or secretion after meal.
So one patient can take the short acting and the rapid acting at the same time?
Yes, they usually take uh, uh, two types of the insulins, and the first morning injection can be combined. In case the type of the insulins can be combined in one syringe, not all insulins are compatible. So at the morning, the patient usually takes two types. So it's one long acting and one short acting, and then uh, two other doses are before the lunch and dinner.
Huh? They take 4 times a day?
They take three times a day, but the first dose, so like the first shot, is combined. So it has a one long acting that will act during the day and night. So what usually is detamine or glargine, and then the second is a short acting. So one is to replace the basal secretion of the insulin, and the second type short acting is to mimic the postprandial secretion, that is secretion after the meal. So there are some patients that take a normal insulin like twice or three times a day without the uh, long-acting insulin. Like because this short-acting and long-acting, they appeared like several 10 years ago. So like 10 years ago, that every patient was only taking the one type of the insulin, that is human insulin. that is zinc. It's it's with a zinc insulin. Uh, and so that was intermediate acting. So it's one type of the insulin that replaces both basal secretion and the postprandial. Okay, then uh,
Excuse me, teacher, what is the meaning of hemoglobin? AC, A1C, or what is this?
hemoglobin uh, uh, one
A1C small.
A1C is A means adult. So 1C means the type of the adult hemoglobin
Diabetes?
that is connected with the glucose or
Mhm.
glucohemoglobin, and the concentration of that. So the concentration of that hemoglobin is directly proportional to the mean glucose concentration of in blood for the 1 month, because the half-life of the hemoglobin is 1 month, and that is used to check if the treatment is efficient. So in
Mhm.
normal patients, it is only 7% of total hemoglobin. And if it increases, that means that the treatment is not effective. We need to increase the dose. Uh, and if it's uh, low enough, that means that the dose is high. We have to decrease the dose. But usually about it's about 8% with those patients who are treated well. So never is seen normal in diabetic patients.
Mhm.
So you can measure the glucose level like every day during 1 month, or you can measure once hemoglobin A1C, and that will uh, evaluate the treatment effectiveness. So it's very vital sign of the good treatment, because you cannot
Teacher,
measure the glucose level continuously.
diabetes has treatment.
Of course it has.
Diabetes has treatment.
Of course, we are discussing now the treatment.
But it isn't it chronic, teacher? Like they stay their whole life taking insulin and making their diet.
Yes, they are, but it is still called treatment.
Um,
Not every treatment will cure the disease, like many diseases are chronic, like Parkinson disease, the schizophrenia, and many other diseases are chronic, like cardiovascular so arterial hypertension, or the heart failure, um, the Gynobacteries, uh, many other diseases are chronic.
okay, question please, teacher. Like the sugar coma, it comes because the insulin is very low and um what's it called? And the sugar level is very high in the blood, right?
The sugar what comes?
Coma.
Coma. Hypertension, uh, glu- hyperglycemia is called hyperglycemic coma.
Hyperglycemic coma. It's because the sugar level is very high in blood. And
Yes,
so you
and
need,
also it can be very low in blood, and also will be coma.
no, for diabetes patients. Like when they have this, they take candies or something sweet.
When they take sweet, that they have hypoglycemic, so low sugar, because of the high dose of the insulin, so overdose.
But they take the dose as the doctor said.
Yes, but if they forget to eat afterwards, then they can get a coma.
Oh,
So the blood sugar level is decreased uh, more than it's required, because the insulin is taken before the meal, like 30 minutes before.
yes.
uh, and uh, if for some reason they cannot eat or forget to eat, then uh, they can suffer from the hypoglycemia. So usually it is treated by taking the something sweet that is fast absorbed like liquid, or by intravenous injection of glucose in case of the coma. So in case they cannot swallow themselves, so then the emergency team will inject glucose solution intravenously.
So not every coma is they have to take sweet thing.
Have to take what?
How they how they will know it's hypo or hyper?
Or if they forget to eat, then it is low sugar. But usually those patients that take medicine, they don't have hyperglycemic. They only have a low sugar.
Yes.
So
Oh,
because
okay.
if you take medicine, uh, then there is no way your sugar will be high.
Yes, yes, teacher. I now understand. Thank you.
Uh, and symptoms are a little bit different.
Mm-hmm.
So
But
uh,
in home, like with my grandmother, I think because always that she takes a candy or something.
but actually taking candies is not good. Also, uh, it's better uh,
So good.
to decrease the dose of the insulin, or to eat in in time.
Actually, she eats in time, but sometimes she fasts, but fasting is not good for her. The doctor said she doesn't have to fast, and like there is a problem. She wants to fast, and we say to her, "Don't fast,"
That's
and
right.
she insists. She
Oh,
insists.
that's right. And the doctor told she should follow the doctor recommendation, because it looks like you have a good doctor, because I support him completely. So tell your mother uh, that you are now also a pharmacist, so she should follow you. So you can tell that, uh, mother, I learned the diabetes at the university, so now my recommend. So I you should follow my recommendations now.
Okay.
Maybe she will not listen to she's not listening to the doctor, because doctor is like a not family member, but she will listen to you, because she loves you more. So that's the problem with the uh, diabetic patients.
Mhm.
Uh, so they require continuous injection and continuous so
Right.
the diet is required. So diet means that the food should be low sugar content and also it should be taken uh, in time with the medicine. So like for the short insulin, for the Lispro, Sandy, what are the short insulins? Lispro and
Lispro, Aspart,
Aspart and
and Glulazine.
glulazine. So these three are different with the food. So some of them you can take food simultaneously, some of them 50 minutes before, and some of them is after, like 15 minutes after the. So these short insulins, you can take food simultaneously with the short insulins. That is more convenient. Or even like during the meal, or simultaneously with the meal. That is more convenient. Yes. Okay, and what are the ways of the injection, Salma?
The ways of injection.
Yes.
There is the subcutaneous, and there is also one. It's like a device which measures your glucose level in the blood and gives you the administration according to your glucose level.
Really? Do you have this one?
No, no, we don't have this one.
I mean, it is device that automatically measures glucose and then automatically doses.
Yes, I saw a video about this.
So we don't have that one in Russia at all. So that's like I know that there are some devices that can inject with the press of the button, like the uh, for needless injections. But
Um,
those that are measured automatically, it's like never heard about that one. Are they expensive?
I think so because it's in Gulf country. I saw one patient there.
Where?
Gulf country,
What is the Gulf country?
the like Saudi Arabia and United Arab Emirates,
Oh,
Bahrain, on
I
these
see.
countries.
So in rich countries, okay.
Yes.
So, but most of the patients will not have access to this kind of device, so they have to measure themselves with a glucometer. What is a glucometer?
I
Measures
think
the
it's like a
glucose
small
in the blood.
device which measures blood sugar levels by taking a sample of blood.
Okay. Salma, do you have one?
Yes, teach the one which itch inch you in the finger and take a piece of blood and measure, right?
Right.
Yes, we have this.
So, how do you measure the blood glucose level, Salma?
I don't know. My uncle does. I didn't try.
So you have to try.
Yes, when I go.
I
So,
think that there is a needle which is attached to this device. You just um like I don't know, make maybe a small injury with this needle, and then take some blood on this special paper, and you put it into the device, and then it measures your blood glucose levels.
okay, so there are special stripes,
Yes,
and you use a needle like it's usually it is automatically uh, hits the so special needle that have a spring inside then you can press the button and then it will hit the
Yeah, exactly.
so and make take a drop of the blood from the finger tip and then you can measure the level. Stripes are one-time use, like uh, then you have to buy new ones, uh, so they are uh, replaceable. And it's very important to make sure that you keep the stripes closed in the tight box because they can absorb water and then uh, the measurement may be not accurate. And also for the device, it requires calibration from time to time. So that is why, like once a year calibration is re recommended. And these devices can help a patient to monitor the blood glucose level and increase the treatment effectiveness. Okay, also the insulin can be given intravenously in case of the hyper,
Hypoglycemia.
yeah, right? But usually it's given by the emergency team, not by the patient himself or by the uh, or by the family members.
Teacher, for intravenously one, the immune system doesn't attack it.
No, because insulin, human insulin is identical,
It is
and
not from cows.
from what?
Cow.
Yes, and from the calves it is also almost identical, and that is why immune system will not attack. However,
Mm.
there may be some impurities of other proteins, except other proteins other than the insulin, if the if the, not it's not completely separated, and there may be allergic reaction for that.
Mhm.
Salma, do you use insulin from cows?
From cow. Yes, I read before on my grandmother preparation.
But your mother is using a human, right?
My grandmother what?
I mean,
Using what?
so currently, your mother, right?
Grandmother.
Grandmother is using human, right?
I she uses two types of insulin.
Okay,
Like just today I learned, so I will ask her which like, but I remember when I was young I read on this preparation it's from cow and it's from Denmark also.
okay, I see. I think she's not using a cow anymore. Uh,
Uh-huh.
uh,
I will ask.
but like 10 years ago or 15 years ago, that may
Yes, she
be
actually having. Yes, she is actually having since I was little.
okay. So, like many years ago, it's all every patient was using a animal insulin, and that like was normal. But nowadays, most of them switch to the human because less adverse, less allergic reactions because of the difference of the insulin, because it's slightly different. Still, it's effective and no immune reaction, but allergy is more common with the animal insulin.
Mhm.
Okay,
Teacher, type 2 insulin is curable, right?
type 2 diabetes.
Yes, to diabetes.
Yes, it can be treated with oral agents.
And by losing weight and also having a good diet, right?
A good diet is required for any diabetic patients.
Because also my teacher had it when I was 15 years old.
Do you mean type 2?
Yes, it was genetically.
Okay, so what are adverse effects of the insulin therapy?
They also can have nausea, vomiting, diarrhea, right?
Mm, for the insulin, uh, does your grandmother has uh, all these symptoms?
I never seen her having these symptoms. Only the coma which she has.
Only coma. So the hypoglycemia is one of the most common adverse effects with the diabetic patients.
Yes.
So, and the,
Hypoglycemia?
yes, so low sugar is most frequent
How
adverse
is
effects.
that a symptom of the treatment?
Sorry, what do you mean?
How is that a symptom of the treatment?
How is that? What do you mean?
A
How
side
is
effect, sorry, a side effect.
side effect?
Mm-hmm.
It is a side,
Hypoglycemia, it's a side effect of the treatment, right?
right?
How?
Or because the dose
The
of the
treatment raises the blood sugar, right?
no, the treatment lowers blood sugar.
It can lower it to the extent of hypoglycemia.
Yes, and it's frequently maybe a case.
Mm-hmm.
So, because the glucose level depends not only on the food, depends also on the stress, on the like on the GI uh, state, right? And then other drugs can influence, like beta blockers, uh, like used for treatment of the other diseases. Like if patient with diabetes can be also hypertensive, then he or she will take other drugs that can influence the insulin release and also the glucose synthesis. So and then hormones can also influence so many things that can influence the glucose level. Even the stress state, like uh, the physical activity also. So, and what are other adverse effects, Sandy?
Fatigue,
Fatigue, okay.
shaky hands, increased appetite.
Oh, well, yes, the appetite will increase.
But I thought that the appetite will increase if you have hyperglycemia.
No, it's vice versa. Hyperglycemia usually is not directly connected to the appetite, but usually after taking a meal you have a high glucose, and that stimulates the insulin release, and then the glucose level is decreased.
Headache,
Headache, okay.
tachycardia, but I did not understand why tachycardia.
Tachycardia are seen in patients with low glucose. So because the sympathetic nervous system is activated.
And that's all I think.
Okay. Uh, Also for the injectable insulin. There is a lipodystrophia, that
Mm-hmm.
is the fat is not evenly distributed under the skin, so the, there, there may be fat that is concentrated in the one part uh, of the skin. So and at the site of the injection, uh,
Hypersensitivity.
no hypersensitivity maybe, but not at the site of the injection, but it can be generally, like uh, especially with the animal insulin. But hypersensitivity is like a yes/no reaction, so like it may be or maybe not. So, but for the at the site of the injection, there will be a hematoma. So, and that is especially important for the women, especially young women, and that is why women usually prefer inject to the sites that are not seen, so that are hidden under the clothes. So that is why they usually prefer the um, injection to the leg muscle instead of the injection to the hand muscle. So because of the deep subcutaneous injection, there is a uh, hematoma at the site of the injection. So it looks like a wound. So that is why maybe not cosmetically uh, uh, not favorite in women. Usually in men it's not a problem. So and that is why some patients will prefer a needless injectors. But yes,
If it's a meatless injections, it will not affect how their body looks.
it will not. It's less traumatic
Mm-hmm.
because the needle is special or uh, less traumatic needle. So the insulin syringe is a little bit different from other syringes because it has a uh, scale in insulin units. So so patient can uh, dose make sure that the patient will dose correctly. So they are more accurate in dosing. And second, they have a small needle and very tiny needle. So with a uh, 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 with low diameter needle that will cause less hematoma.
And also, teacher, they changed the syringe they used only for once.
Yes, that's right, because the syringes are uh, disposable. So, like I think 20-25 years ago, syringes the were reused, but now they are cheap and availability is high, so that's why they are they are disposable. And also, the site of the injection should be changed from time to time. So the patient should not inject always at the same site. Like it can be changed right, left, or even up, upper side, lower side. So uh, there is time required to for the tissue to regenerate.
Teacher, also frequency to go to toilet. It's I didn't see in the book.
You didn't see what?
In the book, like they go to the toilet too much.
Mm, urinary emergency is not usually a adverse effect. So how do you know about that?
Yes, because my grandmother also like this. But I
Oh,
didn't see in the book.
so maybe that is another disease, not connected to the diabetes.
No, it's yeah.
Why
No,
you?
it's like she has diabetes only.
She has diabetes only, but maybe the other disease is undiagnosed. But usually, the insulin will not increase the urinary emergency. So if it's not
Mhm.
written in the book, that probably is for most patients it's not a problem. Not
Uh,
not sure about your grandmother. Uh, so the diabetes is actually there is so the definition is connected to the uh, urinary system because uh, this is a Greek word that comes from the disease of the uh, kidney, but usually kidney is not suffering uh, in most of the diabetic patients.
thank you. Please.
So like it's diabetes mellitus. So there is another diabetes that is connected with the urination, but it's totally different disease. So there are different types of the diabetes. So we are now discussing diabetes mellitus, that is glucose intolerance. So by the way, we can make a break if you need. Do you want a break?
Are we almost done, or we still have a long discussion?
We have about half done because we have it. We completed the insulin, but there is also a oral hypoglycemic agent, so we have to discuss that too.
Yeah, maybe then we can have a break.
Okay, let's make a break. So I think 15 minutes.
Okay.
Okay, good. Then see you in 15 minutes.
The absorption of glucose.
Oh, yes, they are. Uh,
Hmm.
so what is the difference between Curable and what is this second drug?
Acarbose and miglitol.
Okay, so what is the mechanism of action? So actually, its
Uh,
mechanism is in the name. So, but what is the enzyme
like
location?
in Latin, you mean?
No, I mean the name of the group, like alpha
Oh, they inhibit
glucosidase.
alpha glucosidase
Okay,
enzymes.
yes, but what is the alpha glucosidase?
It's an enzyme which break down carbohydrates
Where?
in the intestines.
Okay, so in the intestine, so they act in the intestine.
Mm-hmm.
Okay, so then uh, adverse effects.
Um, I think it would be some GIT disturbances
Uh,
like diarrhea,
yes, it's correct because any other
cramps.
cramps? Are they
Mm-hmm.
absorbed? Like to the systemic blood flow?
No.
So they are not absorbed, at least for acarbose. Acarbose is not absorbed, and
Mm-hmm.
migritol is absorbed but no side effects.
Mm-hmm.
So that is why less side effects here, uh, uh, except the GI disturbances.
Yes.
So and the last group.
Dipeptide peptidase 4 inhibitors.
Okay, so uh, what are the drugs?
The drugs. Um, Allogliptine, saxagliptine,
Okay,
sitagliptine,
so
and
this
linagliptine.
okay, so these are called gliptins sometimes.
Mm-hmm.
So those who don't want uh, to remember dipeptidyl peptidase 4, so or DPP4, then you can use gliptin term. More commonly used actually. So this is a new drug, like new class of the drugs
Mm-hmm.
recently introduced, like about 5 years ago, I think. So what is the mechanism of action?
They decrease glucagon levels.
How?
Mm.
Increase glucagon will be
No,
reduce insulin,
decrease.
decrease glucagon.
Mm.
So and the glucagon is the antagonist of the insulin.
Insulin, yes.
Okay. So what is the adverse effects?
Adverse effects.
Yes. What are adverse effects?
Headache.
Headache. Okay.
And nasopharyngitis.
Okay. So uh, actually, adverse effects are more mild adverse effects than other drugs.
Mm-hmm.
Uh,
Why
okay.
does it cause nasopharyngitis? What's the relation between nasopharyngitis and this class of medicines?
Uh, it is adverse effects. The reason is not known.
Mm-hmm.
So uh, but the it may be the central action, like not direct, because they are
Mm-hmm.
not used intranasally, they use orally. So maybe some central uh, action. So it's not yet uh, understood, and nobody cares why.
Mm-hmm.
Because when you have a diabetes, then nasopharyngitis is not a problem. So it is a problem, but
It's
still,
not the big problem here.
sorry.
It's not the big problem.
Yes, it's like when you are dying from diabetes, nasopharyngitis, like is not a not a much deal. So,
Mm-hmm.
and as with any other medicine, uh, as and with any other uh, medicine for diabetes, there is always a trade between the effectiveness of the treatment and the adverse effects. Like you can never get a ideal treatment. Like you always will have uh, or hypoglycemia or hyperglycemia.
Mm-hmm.
And
Yes, with the sodium glucose co-transporter 2 inhibitors, there is a risk of hyperkalemia.
okay, why?
What?
Why?
Because it increases the urinary glucose excretion.
Okay.
And that's all.
Okay. So yes, we forget about the uh, this new group, sodium glucose co-transporter.
Mm-hmm.
So what are the drugs?
Um, canagliflozin and dapagliflozin.
Okay, so they are not available here in Russia,
Mm-hmm.
as far as I remember, and so they are relatively new drugs. Okay, then so there is always a trade between the effectiveness of treatment and the incidence of hypoglycemia, and usually the physicians will choose one of the two uh, strategies. So first strategy is like one of the strategies is uh, aggressive treatment, like when the high doses are used, and that
Like intensive.
yes, intensive,
Mm-hmm.
and that leads to the more frequent hypoglycemia. And the second is less intensive, and that lead to the uh, bad glucose control, so hyperglycemia. And hyperglycemia, a patient will not suffer immediately, like there is usually no coma, but that leads to the renal failure, uh, visual nerve, uh, 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 visual nerve diseases like the uh, blindness, and then also the cardiovascular diseases. So this is one side, and then the other side is frequent uh, uh, hypoglycemic episodes is another side. So depending on the patient and on the physician, they usually agree on something, and then the patient will suffer from one or another. So that is unfortunately that is most of the time a, a problem. Questions,
None, I think.
Salma?
Thank you, teacher. No.
So you are welcome, and hope that will help your future diabetic patients. Uh, and if no questions, then the next class is uh, estrogens and allergens, or the sex hormones. So
Mm-hmm.
we mostly will talk about the estrogens because most of the drugs here are for women, not for men, unfortunately. So mostly about contraceptives. So prepare your questions. And Sandy, could you please send a message to the group that we will have this topic so everyone can join this discussion?
Yeah, sure.
Then maybe you can also make a group uh, in Messenger, so we can make the online classes in the Messenger if you it's more convenient for you.
Okay, I will ask them.
So because I noticed that not all of you are joining, Maybe if I will call in Messenger, then everyone will receive immediate notification. Then will uh, uh, maybe that will uh,
I think we are more used to Zoom.
Zoom.
Hmm.
Unfortunately, Zoom is not allowing more than 45 minutes.
We
Then,
usually, after the meeting ends, we usually enter again.
as that means that we have to make a break every 45 minutes. That is not very
No, we
convenient.
usually we usually just enter and we continue
Okay,
with.
but uh, so but we have like 3 hours classes. We have entered 3 times.
Mm-hmm.
So
Yeah, I understand.
that is not very convenient. So I noticed because we have this experience at the uh, department meetings. So and then the head of the department said, okay, we're ending now, and then like a 5-10 minutes, everyone is joining. So the head of the department is at the end he told us like, now I am speaking, but if I stop speaking anytime, that means that our time is over, but I am not sure when. So and that is like a suddenly it stops, and then someone can think that it's a problem of the connection, etc. So
Yeah.
so here it's actually it's I think more it's more convenient, and actually the same. And maybe the messenger will encourage students to join the class because it's already in the phone. No need to install additional application. So maybe.
Okay, I'll ask them.
Okay, so thank you very much, and see you next week. And happy iftar.
Thank you, teacher. Goodbye.
Bye bye.
Bye.